Hello everyone, my name is Palak Veriwala. I'm your health coach at Besugarfit, and today I'll be telling you the difference between type 1 and type 2 diabetes. Well, we all know about diabetes complications, diabetes symptoms, but do we really know whether it is type 1 or type 2? Well, type 1 or type 2 diabetes is basically elevated blood sugar levels. The only difference between these two types is how these sugar levels go up. Today, I'll be telling you just that. Type 1.5 diabetes is caused by an autoimmune disorder where the person's own body destroys the beta cells of the pancreas, which is responsible for making insulin. As a result, the body does not have insulin at all or in very insufficient amount, due to which it cannot control the sugar levels. Just to give you a background, insulin is the hormone which is responsible for transporting the glucose from the blood and putting it inside the cell where it is used as energy. When a person does not have insulin, the glucose stays behind in the bloodstream and does not get metabolized for energy, leading to increased blood glucose levels. And this is exactly what happens in type 1 diabetes. Whereas in type 2 diabetes, a person has some beta cell function. Either they make insufficient insulin, where the values or the quantities are a bit lower, or the insulin is in sufficient quantity but it is not being able to function efficiently in the body, meaning the body is having insulin but it's not being able to do its function. And this is the difference between type 1 and type 2 diabetes. Type 1 diabetes is caused by lack of insulin, whereas type 2 diabetes is caused by insulin resistance. Type 1 diabetes is juvenile onset diabetes, meaning it happens to people under the age of 18 generally, and whereas the type 2 diabetes is more adult onset. People generally see it towards their adulthood, generally above the age of 40. But now with recent years, because of our poor lifestyle, because of our poor eating habits and highly stressed life, this threshold has actually come down, and people even in their 20s are now getting diagnosed with type 2 diabetes. Type 1 diabetes risk factors are not known. They are a genetic disorder, so that does not have any risk factors other than if you are genetically predisposed to it. Whereas in type 2 diabetes, poor lifestyle, poor physical activity, improper eating habits, too much stress can be the risk factors. The symptoms of type 2 diabetes happen gradually over the years. You don't see them happening all of a sudden one fine day. It just slowly develops and gradually expresses itself. And that is how you can understand to some extent whether you're type 1 or type 2 diabetic. The symptoms in type 1 is very sudden, whereas in type 2 it's very gradual. The symptoms are although very similar. They can be increased thirst, increased hunger, frequent urination, feeling very tired, lethargic, and these symptoms can be very commonly, mistreated as some other issue. That is why getting tested is the only solution to being able to identify if you're having diabetes, be it 1 or 2. The basic tests that are required is the HbA1c test, that is the glycated hemoglobin test, to understand your 3-month average sugar. What you also need to get tested is your fasting and your PP sugar levels to understand whether your sugars are under control or they are in the elevated phase. But to distinguish between type 1 and type 2 diabetes, you need to conduct some extra tests to understand whether you are type 1 or type 2. This test is not a requirement for all, but if you have been trying to manage your sugars for a while and it is not coming under control despite all of the efforts, then you should go ahead and get your C-peptide and fasting insulin checked in a laboratory, and then go to a clinical physician and let them have a look at these reports and decide it for you. If a person is type 1 diabetic, then the only treatment option is insulin therapy. In this cases, a person has to take insulin and accordingly do carb counting and understand how much to eat. Whereas in type 2 diabetes, the treatment protocol does not have to be insulin. They can also be on oral drugs which might help to reduce the sugar. And if they complement this with good physical activity, great eating habits, and reducing their stress levels, they can actually even go off medicine, making this a reversible condition. Whereas a person with type 1 diabetes cannot reverse it. There is no cure for it because your body just does not have the cells to make insulin. In this case, you need to manage your diet, manage your lifestyle well, so that with insulin and good health, good lifestyle I should say, you can maintain your sugars without having major complications. Type 2 diabetes is a reversible condition where one can take oral medications, sometimes even insulin, but with great lifestyle, they can also go off them and be reversed. Whereas in type 1 diabetes, a person does not have enough insulin and this cannot be reversed, and a person requires insulin on a daily basis to keep their sugar levels in control. It is very important to check for the symptoms, as these can be very simple and might not even seem like something serious. But make sure you keep an eye, and if you do notice these symptoms going high, then make sure that you are getting your blood sugar levels checked with the appropriate tests and visiting a physician to understand the next line of action. But make sure that you're following a good balanced diet, having lots of protein, lot of fiber, less amount of carbs and fat to keep the lifestyle factors in check. Thank you so much for watching. Take care.